So that's a really good question because there is concern out there that many people are ignoring a lot of their normal health problems out of fear of going to doctors' waiting rooms and maybe catching the virus, etc. And also based on some of the advice that we shouldn't be leaving the house at all. So I think if we look at the 5 general things in our overall health that's important to look after and just go through them one by one and discuss them very briefly. So the first one is your overall diet, thinking about what you should be eating every day, trying to avoid too much junk food or takeaway food, trying to make sure that you're having a good mix of, fruit and vegetables and protein type foods, not loading up on carbs too much and, those processed sort of easy to prepare meals, which I know that's sometimes difficult during exam time, etc. There's lots of variety out there, especially ordering online these days. You can order from sort of 5-star restaurants if you like, or just on your Uber Eats. You'll always get a good variety of food. The second thing is exercise. So if you're living on campus, you've got this massive backyard, you can get around, get onto the lawns, do some exercise, try and maybe form buddies systems. There can only be 2 of you, of course. I know there's some personal training available online as well. But getting out like at least 3 times a week for a good sort of 30 minutes to do what we call huff and puff exercise. So that's not just a gentle walk up the hill. It's really getting your heart rate going. Very, very good for reducing anxiety and for improving your overall well-being. The third thing is sleep. Now, I've seen quite a few students during the overall sort of lockdown where we're stuck inside a lot and they're sort of just turning into like a 24-hour sleep-wake routine and just losing the day-night pattern, which is not good. We know that that sort of disordered sleeping pattern will generally lead to mood disturbance, more anxiety and fatigue, and you won't feel great. So try and get back into a pattern where you're waking up at the same time every day. A little bit of variability as to what time you go to bed isn't too bad, but make sure you try and get up at the same time every day and get out for a bit of a walk or exercise in the morning to try and set up that good sleep pattern, and try and avoid napping too much through the day as well. The fourth and fifth things are just general looking after yourself type issues of make sure you're socialising. I know it's difficult, you can't get together in groups personally, but try and enjoy your group chats, all the funny things, I suppose, that you see going around on YouTube and on WhatsApp. Make sure you're keeping in touch with your friends and family. And of course, if you've got grandparents and oldies, make sure you're keeping in touch with them as well. And the last thing is make sure you're still doing things that you enjoy. Now, that's not easy sometimes if what you enjoy is going to the gym or what you enjoy is going to watch sport within a crowd, etc., that aren't working at the moment. But maybe there's some hobbies that you've really loved doing that you haven't had time to do, or taking up other sorts of activities that you really enjoy. Make sure that you're allowing yourself time to do those things to distract yourself a bit from your studies. So overall, I think it's a matter of just trying to keep that balance in your life, which is not easy during these times.